I've been talking about Parkinson's in the last couple videos, so I want to tell you a couple stories about Parkinson's patients. This has happened a couple times for me, and as we described in the last video, these patients can get what we call totally locked in. Their body becomes rigid. They can't respond emotionally. Their faces look very masked. They're just staring off into space, but they're really in there. Their brain is still there functioning, but they're really locked in, a prisoner in their own bodies. It's very sad and very frustrating for the patient, and so sad for the families. I've had several patients, and I'll tell you about one that just recently told me he just couldn't take it anymore. He just couldn't communicate. His life didn't have any quality, and he wanted to know what he could do to end his life earlier. Oftentimes I have to say, well, there isn't any just switch that we can provide for you unless you take care of it with MAID, medical aid in dying, and he didn't want to do that. So I always share with my patients, well, the fastest way is to stop drinking fluids. Again, calories don't mean a thing. We could all live for, months, year on what we've got stored here. But we have to have fluids or we die within 2 to 3 weeks. So he talked to his wife and his family, and they decided that's what they were going to do. And he was living in a facility, so we had to be really careful about letting the team know that no meals were going to be provided. And actually a note was on the door to please check with the nursing station before giving any meals. Of course, he could always ask for something if he wanted to, but nothing would be delivered to him. And the formal name for this is VSED, voluntary stopping of eating and drinking. And he was already very debilitated. So remember that when you stop drinking, your own brain is so beautiful. It makes your own endorphins. That's your own morphine to help you be comfortable when you're not drinking and the body is drying out. And of course, we did have comfort medications available to him when he wanted them. His family gathered, they stayed with him, they sang songs, they looked at pictures, they did everything to help the quiet and the quality of his life close so beautifully. It was so beautiful to see. And so remember, for your neurologically impaired patients, ALS, Parkinson's, this locked in happens so often. Help them find the dignity and the choices that they need to make. Get our booklet, The Hospice Care Plan. Visit our website, The Hospice Care Plan.